Listener discretion advised.
If you've been affected by the rampant opioid epidemic, as we have, then this podcast is for you. We want to bring hope to those suffering from heroin addiction and shed light on its darkness. Let's share an environment where we can discuss all aspects of heroin addiction without shame or judgment. Our mission is to educate the community about heroin and its deadly sidekick, fentanyl. How easy it is to get, how easy it is to become addicted, the latest treatments, and its newest targets. JCF is a nonprofit organization created to honor the life of Jeremy Castro, who passed away from a fentanyl overdose in 2017. Now, my family and I are doing our part to combat this opioid epidemic. I'm Rebecca Castro. I lost my brother and many friends to heroin, and I made this show to demand eradication of this epidemic. Let's do this. Today on our show, we have a board-certified drug and alcohol counselor who is also my cousin, and her name is Kelley, and she's going to go ahead and share a little bit about herself.
Yes. Hi, everybody. My name is Julie Kelley. I am a drug and alcohol counselor at Valley Women's Center. It's a nonprofit substance abuse outpatient program located in Canoga Park in Southern California. Yeah.
Thank you so much for being with us today.
Oh, thank you for having me.
So the topic that we're going to talk about, so I know you have a wide variety of knowledge on all of this stuff, but the topic that we're going to talk about is treatment, or the barriers to the treatment of opioid use disorder.
Yes.
Is that correct? Okay.
Well, it's crazy, with all the funding that's coming in for not only addiction, but this opioid crisis, it's crazy that not even half of them are actually receiving the treatment. So when we look at first, it's a money issue. We don't have funding for it. And then all this funding comes in for it. And then it's like, wait, half the people are still not being treated. So taking a really in-depth look as to why and what those specific barriers are to them not getting that treatment. So it's really kind of interesting. The first one being, of course, practice-related barriers, which would be the physicians that are certified to offer the MAT services. They are definitely talking about some concerns that they have that's made it difficult for them to bring people in and actually access and give them treatment. And that's just been, they don't want, the addict population, dealing with addicts is definitely not for the faint of heart. You have to be able to look past all the lying and the manipulation. And I can tell you as a counselor myself, I have definitely been in the room with someone, as a matter of fact, just yesterday, that I wanted to knock her out. Not literally, but you know what I mean. Addicts, it's the victim role. It's everybody else's fault. This is why this is happening to them. And it can be really, really frustrating, especially for somebody in the medical field that doesn't have an understanding of addiction.
Absolutely.
And that this isn't really who they are. This is just the way the manipulative behaviors that addicts do in order to continue their drug use,
Absolutely.
So number one, a lot of them don't want to deal with addicts, right? And just that behavior, the inconsistency.
The flakiness.
Exactly. And then the second one would be financial barriers. They're not being reimbursed. Like when I work drug Medi-Cal. And so let's just say drug Medi-Cal pays us as a nonprofit, we get about $3,000 per client for the whole month to do treatment. And I believe with the MAT services, doctors are getting a very, very small percentage of that. So it's not worth it for them, or there's nothing in it for them to want to treat these people, unfortunately. And a lack of institutional support, meaning policymakers and not everybody's on board. Another really interesting thing is that MAT with the Suboxone, Vivitrol, those are evidence-based practices, meaning they are proven. We know that they work, yet nobody wants to put all their money in that, which is really interesting. And the only thing I could think of is that whole stigma of treating a drug addiction with a drug. That whole idea that the old AA belief that if you're on any type of mental health medications, you're not sober.
Right. Absolutely.
And again, it's breaking through that. And just like the doctor that you had in here previously was talking about, being willing to try anything that's going to work. We have no idea what's going to work, so just throwing everything at them and seeing what sticks. But knowing that we have an evidence-based practice that's not even being utilized is really, really frustrating for those in the field.
Absolutely.
Yeah.
It's almost just like they're being closed-minded about it. And again, that's why we're here. I tell everyone, all of our guests, we are here to get past that negative stigma that, oh, these people are just drug addicts. But I do want to go back really quick. Can you just for our listeners, give us just a brief explanation of MAT?
Yes.
The concept of MAT.
MAT is medication-assisted or medicated-assisted therapy.
Okay.
And what that is it is medications that are introduced, there's a few of them that are introduced to help alleviate withdrawal symptoms because, again, like we talked about, pain is the big motivator for people to go out and use.
Yes.
So if we can keep that at a minimum, the whole saying is comfortably uncomfortable.
Yes.
We want them to remember a little bit so they don't repeat the same mistake, but not so uncomfortable that they're going to bolt and leave, which is what we see a lot in treatment. But what's the most important part about MAT and why it's so successful is that it's really pairing the use of medications with counseling and behavior therapies like cognitive behavior therapy. It's the most effective in the treatment of opioid use disorders and can help a lot of people sustain long-term recovery because without that, it's hard to get there.
So do you dispense any medication in your treatment? Do you use any MAT?
Unfortunately, no.
methods?
We are a substance abuse. We're an outpatient program. So not to say that our clients need to come to us detoxed and clean already, because they certainly don't. But we do not offer that. We would refer them out, which is another big part of what we're talking about here today is, to me, I think the biggest barrier, even before the doctors and the physicians that we're talking about, which is really related to MAT, the biggest barrier is not getting a proper thorough assessment when this patient comes in,
Yes.
looking at the whole thing, all the patient complexities, where they're living, their education, their sexual preference, all of that stuff comes into play when you're trying to refer someone into treatment. And I kind of feel like that assessment is not being done properly. They want to get through it, or what we're seeing a lot is outpatient facilities that are client brokering that want to get that client in. They know during that assessment that client is not going to fit or meet their level of care, right? So we all have levels of care. Level 1 would be outpatient, then you have 2.1 is intensive, partial hospitalization, and all the way down to like 3.7, which is like medically induced intensive inpatient treatment, right?
Wow. Yeah.
And so they want to get this patient in and they're going to make them fit their level of care, which is an outpatient, so
Right.
that client can then be admitted and come in, right?
That does not work.
Right. And so what happens is they're not getting what they actually need. They're not going to where they need to go. It's interesting. I had a 17-year-old girl come in just the other day with her mom, who had been experiencing some severe depression, and the psychiatrist where she was being treated called me, and they had put her on all these medications, and they've noticed that the symptoms were getting much worse. She hadn't slept in 3 days, and she came in to see me and I told the psych that I will do the assessment, and if I can't treat her, which I kind of at that point didn't think that I could, I would definitely point her in the right direction. And unfortunately, not everybody is going to take that time to put phone call, get on the phone, call all these treatment centers. Drug Medi-Cal, we're an umbrella of providers. So Tarzana Treatment Center, Cry Help, there's a lot of really great places. Impact House in Pasadena, Claire Foundation in Santa Monica, there's a lot of great places. We have access through what's called the Service Bed and Availability Tool. Part of about 2 years ago when all the funding came in and Drug Medi-Cal started to pay for all these detox services. So as a Drug Medi-Cal provider, we now have access to a portal system, so to speak, that every single provider within Drug Medi-Cal gets to look at. What's really cool about that is it was implemented to be able to get clients into treatment now, because you have that small window of opportunity with an addict when they're like, okay, I want help.
Right, yes.
And then, you call up the treatment centers and they're like, oh, waiting list, how about next year, 20, and that client's not ready to do it anymore, so you have this small window. So they created this system that gives us the ability to look at every single open bed in LA County.
Awesome.
I mean, through outpatient, OTP, which is opioid treatment provider. It's a really nice tool. So when someone comes in, like this girl that I couldn't help, I have access and I can see all the available beds and what would be most suitable for her.
That is so, what a useful
amazing.
tool for you guys.
Well, it's important to know, I mean, at least I feel it's important to know as a counselor that you're pushing 12-step therapy, you're pushing all these, they're trusting you, do this and you'll be okay, right?
Right.
And you're pushing all this stuff on them, not realizing that that's not gonna work, it's not what they wanna do at all, So it's meeting them where they're at and helping them to make the best decision about that.
Absolutely.
Yes.
Guiding them in the right way, at least, right?
Right.
Okay.
So, Julie, I know that you work for a women's center. Do all your women, all your patients come from court-ordered situations, or say, if I had a friend that needed help, could I refer them to you and she would be treated through your facility?
Absolutely. We are actually one of, I don't want to say a few because there's quite a few of us, but a DCFS approved parenting and prevention curriculum program that we do.
Very good.
So we're Prop 36, meaning someone gets a drug charge and it's either treatment or jail. And a lot of them then decide to go into treatment, which is a whole nother discussion to have about that. But most of them have lost their kids through DCFS, so they are required to complete a full substance program in order to regain custody or reinstate, even reunification sometimes. But we do have a lot that come in voluntarily that got our number because we're drug Medi-Cal. The county, people that are on GR, food stamps, CalWorks, GAIN, all these county programs are giving out our material and all the other providers to these clients that are coming in that have our information. It's kind of one of the nice things about us is we're certainly not in the business of standing out on the corner with a megaphone.
Right.
Or in front of inpatient treatment centers handing out substances so we can get these clients back in our system, our program, We get a lot of flow. I would probably say, honestly, I schedule about 20 assessments a day.
Wow.
And I absolutely love it. For me, it's being able to look at the whole patient and put together a plan and interventions that are specifically, they specifically address their issues. I absolutely love it. I absolutely love that part of it. So it's, yeah.
So if I'm a pedestrian, an outside person, coming to you for treatment for the first time, I would be assessed, and then you could refer me to rehab, and how often would I have to come see you? Is it a one-time thing?
It's a one-time thing. Yeah,
okay.
as a matter of fact, when you come in for an assessment, a lot of people think it's an automatic intake, right? But with drug Medi-Cal, two things need to be determined in that assessment. Number one, that they meet medical necessity. Drug Medi-Cal is not going to fund or give money for someone that hasn't used in a year. So there has to be like all these little, they have to use within a year. They, of course, have to have Medi-Cal, which we run into a lot where they don't have Medi-Cal. And, it's case management. I would never be like, well, go down to county and sign up for Medi-Cal and then come back here. No, I'm going to sit down right there with them in the computer and sign up for Medi-Cal and get all that done and help them access that.
So you really hold their hand every step of the way.
I do.
Well,
That's
that's
amazing.
so helpful.
I do.
Otherwise, it
Yeah.
wouldn't get done for an addict. You can't
Yeah.
put these legal, governmental forms in front of them and say, here, fill it out. And
Well, it's interesting because there is that idea in this field that they're only going to want it, they're only going to complete it and be successful if they're the ones that are initiating. I had a woman call the other day on the phone regarding her 39-year-old daughter who she hasn't seen in weeks. She's on the streets. It's rumored she's getting really thin. It was like a methamphetamine addiction. And how can you... it's nice if the mom is calling, and I love to talk to parents and kind of educate them because, again, it goes against every grain in our body. You are the exception, Rose. You really are, because most people are not strong enough to do what you did to save your baby, and most of them love them to death, and that is what we see as really, really dangerous, you know. But yeah, that idea that the addict is the one that has to make the move. And we like to say that if I have like this woman called in, I could talk to her and give her a lot of great tips and advice and encouragement, but ultimately her daughter needs to call in. I mean, anytime someone's dragging someone into therapy or into treatment, and they're against their, you know, they don't want to do it. They're doing it for so many other reasons. And not to say that there aren't cases where that works. You know, I always say we're planting the seed,
Right.
because that's what it's about. The minute they have that thought, now when those negative consequences all start creeping in, they're going to remember what I said in group one day or something like that, you know? So it's interesting, that idea that I hold hands, yes, and I think that a lot of that is
It needs
because,
to be done, though.
Yeah, well, I'm a recovering alcoholic myself, 4 years sober, and though I come from this great family, I had to be my own rescue. There was no one coming in. I mean, even after 4 years sober, I've never had a conversation with my mom about how's that going for you?
Yes,
you know?
absolutely.
So for some of us, we need to be self-motivated to do this. Otherwise, it's not going to work. It's not going to stick. you know?
Exactly, and it's definitely case by case and situational, like you said. But you know, for example, our foundation, JCF, we do help Sober Living House. And actually, recently, someone reached out to us. It was a brother and a mom reaching out on behalf of her son and his brother. And basically, you know, they gave us some information, but ultimately, you know, my mom and I are like, okay, well, now we want to talk to him. Because, you know, we want to make sure that these, not that we're not willing to help anyone, but we want to make sure that they're actually in a mind, like you said, that short period of time where you get them and you actually get them in and they're right there, you know? So we, you know, before we just, do whatever, we understand the moms and everything, but we like to talk to the addicts themselves in addition.
Yeah.
Well, we need to know they're invested.
Exactly.
We need to know they're motivated. We need to know that they're not just doing it for a place to live.
Right.
Like, we want to help you change your life.
Right.
If you want to change your life.
So you have to be committed to it. You know what I mean?
Like this mom that called in, you know, oh no, she wants to get sober. No,
Yes,
she wants
exactly.
to.
Yes,
she
and
wants
she's all
to.
these things. And then the girl walks in and she's just sitting on the couch like, you know.
Just there checking off the box because her mom wants her to.
The mom, and you can understand this, Rose, so panicked and desperate and scared and paralyzed, and you know, that she is willing to do anything. I mean, if it comes to like Benadryl and knock her over the head and drag her in, she's going to do that, you know.
Anything to help.
But unfortunately, you're right. And I know in talking with you about some of the work that you do with JCF, I have definitely known somebody that I wanted to refer your way, or that I thought you guys could really help. And I'm not going to lie about it. There is always that, what if she doesn't follow through in all of this and all, you know what I mean? And because, you know, we're family a little bit, it's like, I don't want precious money that's going, you know, and I hate to say that. The thing is that everybody's got their time in this. Everybody.
Exactly.
It's just a matter of who's going to be a part of the game when they decide to give it up. That's really what it's about.
Exactly.
You know, listen, when we decide to help somebody, we're not asking for a guarantee, okay?
Right.
I know about addiction, okay? And it's a rough path. All we want, and we don't even want, okay, if you come to us and say, please help me, I need this, I've detoxed and I'm here, then we want to help you. But my, writing a check doesn't mean you owe me your life.
Right.
Okay?
Right.
I want you to stay there. I want you to do well. I'm going to check in with you because I truly value you and your life. You know, I've seen it. I love your mother. I've never met her. I love your family for what you're giving them back. And you're giving them back yourself. And you're getting your soul back. And that's why we do it. Okay? There are no guarantees. There are no promises. I'm not going to say, when you have a baby, name her after me. Nothing.
Right.
Okay? My deal with you is that you work to get clean.
Yeah.
That's it.
You just put in the work
to get clean.
That's the only thing that I ask is like you have the willingness and you just put in the work and you know that it's going to be a long road and that you just have to fight through the hard times.
Just like get through this week.
Yeah,
exactly.
And that's what
This
even in
Day
AA
by day.
This month.
they talk about how, honesty, openness, and willingness. That's really all you have to be, in order to do that.
Exactly.
That's like the number one thing, at least for me as a counselor. And, not everybody is going to take this job. This is my life's purpose. There's like no doubt about it. And so for me, it's like I think different than for a lot of people. But I go to all the different AA meetings in the Valley because if DCFS has this as a requirement for them to complete in order to get their kids back, and we have a program mandate that includes AA as well, I don't want to send these people. I mean, I know some shoddy AA meetings. I've been into an AA meeting before where I was triggered to drink and left. Like, you go to, they're like shoes. You got to find the right one that fits.
Right.
There's so many different types of meetings. There's just
And different approaches to the meetings.
Yeah, so it's like if I'm going to refer someone that's never been to AA and I'm going to say to them, this will work, just shut up and listen and go and trust me on this, and I send them to a meeting where the guy standing up at the podium, he might be talking great talk, but when the meeting's over, he's doing something else behind the dumpster. That's just a complete, that is a big deal to me. Like, they're trusting me to send them places, and I'm going to send them somewhere where, they have a risk for relapse, So I like to go to all these different meetings and get an idea of what's out there, what's available, what's a really strong women's meeting, what's this meeting, and the same with these treatment centers. I know a little bit about all of them with drug medic health. So when a client comes in, the very first thing that we assess for is this client stage of change. Where is he at? So the 5 stages is like pre-contemplation, meaning denial's so thick, they're not even on the radar about this being an issue. And right off the bat, if I know that this client is in pre-contemplation, I'm not gonna work hardcore at her to get her here, you know what I mean? It really is, but that's the problem is everybody wants to get everybody up here.
Yes.
When they're really down here. And then they're frustrated and burned out when that client's not coming to that level. So that's the biggest reason for counselor burnout in this field, really.
Absolutely. I was going to say, I think I know for a fact that not all the counselors that have your job go above and beyond like you do. For you to take your own time to go do research to find out what meetings you like so you can be more in touch with your clients or people that come through is amazing. That's real dedication and that's real commitment to your job, and we need more people like you in the field. Absolutely. No, you're so passionate about it.
There's new sober people coming in all the time. I mean, since I've been doing this job, which has been like 4 years now, I've had 3 clients finish the addiction studies program at Pierce and actually move on to be counselors. And the idea that there's the idea that only an addict can understand an addict. There's like a poem or a quote somewhere about a guy that fell all the way down in the hole and he's screaming up at the top like, come help me. And the doctor walks by and hears him screaming and he throws a bunch of medical jargon at him and says, you'll be all right, and walks away. And the priest walks by and he hears him crying, and so he prays with him and reads the Bible, and he throws a Bible down there and tells him, read it, you'll be good. The guy reads it down there and he's still freaking out. And then finally the one normal guy that walks by and he's like, help, help. And all of a sudden the guy jumps in the hole with him. And the guy's like, what are you doing? Are you crazy? Now we're both stuck. And he goes, no, I know the way out. I'll show you. And it's that whole idea that no one knows it better than somebody that's trudged that.
It really is. Like Dr. Torrington was saying earlier, and exactly what you're saying, it's just you have to be patient. Like it's so hard to grasp the concept because it's like the addict's the one who puts the family through everything, and it's like you're on one end trying to push them to get them to do something to better themselves. Right. So it's weird. It's like, how are you trying to push someone to better themselves when they don't even want it for themselves? Right. But it's the drug, like you said, it's the drug, and a lot of rehabs, Dr. Torrington was saying, they don't address he's like, it needs to be everything. It needs to be the diet, it needs to be the mind, the body, how you're exercising, everything. And there's so many things to hone in on, and I don't think that the counselors and the rehabs, I don't think that they do that. I think it's just, they get lost, and there's so many parts to the process. So I really respect your dedication.
Well, nothing changes if nothing changes. And
Absolutely.
that is the biggest part of this. And that's why with you, Rose, even with Jeremy, it was like amazing because you were willing to do the tough stuff that a lot of parents weren't willing to do, which is you're getting the hell out of here and I'm, out of Dodge and you can go stay up there, because it really is an environmental thing. And I don't know if we talked about this last time, but it's fascinating when, Vietnam had 2,500 soldiers come back. They had all been using heroin in order to endure the pain over in Vietnam. They all come back, they're all addicted, yet because they're in a new behavior change or environment, new environment breeds new behaviors. And it was amazing. All of these 2,500 never received treatment. There wasn't treatment for that in the 70s, right? They didn't receive treatment, but all of them were able to recover and moved on and never used again. And how is that possible? And it's a complete change in environment. That's really what it's all about.
Absolutely.
Because just like the guy previously that was here said, the brain has all of those connections, the limbic system that remembers, If I have a migraine headache and I take Tylenol and it doesn't work, the next time I have a migraine headache, I'm never even going to go there.
Right.
I remember that didn't work. So we flag what was enjoyable, what was dangerous, what was bad, and the brain remembers that.
Yeah.
It could be very powerful,
Absolutely. The brain is
amazing.
As Dr. Torrington explained, is a crazy.
Oh, yeah.
I never
crazy,
knew I had all that
fascinating.
going on up there.
Right? Right?
Yeah. Yeah.
Okay, so going back to the barriers, let's talk about some of the ways to eliminate some of the barriers.
Oh, yeah. There's some great ways. I mean, number one thing is education. I mean, period.
Yes.
And, my sister's an RN. She's a labor and delivery nurse, and her and I go at it all the time about this the opioid crisis, epidemic, shall I say. Because, she's holding babies that are going through withdrawal. And it is definitely hard, even as a counselor, I have to admit, having a client use their entire pregnancy, and it numbers, the lab couldn't even test. It was over 10,000. And it's really, really hard. And finding the compassion for that person.
Exactly. If you
But
don't know,
it can be very trying. Like, I see that side of it, Unfortunately, they're just not receiving the education that this ongoing addiction education in hospitals and doctors' offices, where they're getting an idea of why this person is resistant or reluctant, or, to them it's, they don't want it. They're not realizing that brain is addicted. That person doesn't know what they want, So the number one thing that's happening, the one way to break and really start to eliminate that barrier with the doctors. Everybody that, we're not seeing it so much now, but doctor shopping. My sister at one point had a girl that had come all the way from Lancaster and had hit every single hospital from Lancaster to Ventura Boulevard.
Oh my gosh.
Searching for opiates, and was doctor shopping. And that was right at the time the system was going live where they could look up and see, a prescription. You can't do that now, but I can see why the medical community is very
Cynical.
Yeah, jaded, so to speak. Like, I get it. But giving them the education that it's much more than the person. It goes way past that.
It goes into the whole thing, I think, that we talk about as, instead of seeing them as just heroin addicts, it's a disease or an illness, right? And I feel like that's how, again, if you get it, you get it, and the people that get it are referring it to it that way, and then other people don't see it that way at all.
Yeah.
They,
and it's crazy because a lot of these doctors, even MAT doctors, not to talk about age or anything, but they're an older generation of doctor, right? And it's interesting when you look at the old stigma of heroin, that was the scum drug.
Right.
Yes, absolutely.
If you did heroin, like in the 70s, if you did heroin, you were like, nobody even, but now, it's the white collar drug. People, it's got a totally different feel. So I think breaking that stigma with a lot of these doctors and physicians that, again, are struggling to deal with the addicted population and don't understand,
Definitely.
I don't think you really can understand an addict, a heroin addict, that's my experience, until you live with them and see them.
Yeah.
Until you walk alongside them, you don't get it. You don't get it. It's like, how could you be so self-destructive?
And as much as you try, I've tried to explain it to so many people, and I always end up saying, there's no real way to actually explain it.
Yeah.
It's
Well, people act like it was a choice, including me, okay? And it's very frustrating, but it's almost like, no, it isn't a choice. It's your body telling you, your brain telling you, you have to have this.
Yeah.
You have to have it. If you
Yeah.
don't have it, you're going to suffer horrible pain, horrible nausea, diarrhea, back pain, bone pain,
Body
everything.
aches, nausea,
Everything.
yeah.
I mean, yeah, could you imagine
And-
being in positive, I mean, like literally positive 10, gnarly pain, kicking every muscle in your
Yes.
body, cramping?
I can imagine only because I've heard Jeremy go through it.
And pain being the motivator, it's like he's got two options in that moment. What am I going to do? Okay,
Yeah.
I'm either going to call up Passages or get a counselor on the phone that's going to want to talk therapy my butt right now.
Right.
When in reality, I want the quick, instant
That's right.
gratification fix right now.
Right.
And that's what's so hard about dealing with, working with these patients is we can't do it always right now. Even with drug Medi-Cal and having access to all these beds, sometimes it still takes. Again, all my relationships with treatment centers comes into, trust me, there's a reason why we go to luncheons and do it. I hope they're not listening, but it's not because I want to have a free lunch or hang out. It's more about connections, networking.
Absolutely, yeah.
Finding out parts about this treatment center and what they're really good at and what they've honed in on and what this treatment center might be really good at. There's some that let you bring your kids to treatment. So for a single mom that's got 2 kids where treatment's not an option, because who's going to watch the babies? So she's still, So
There's so many different
there's
factors.
so many different factors that come into play. Yeah.
So many.
Okay, so the next one would be one thing that they're really trying to change right now too is of course insurance. And it's another part of this. Drug Medi-Cal is what I do, but even in private insurance, like you said, Rose, the insurance companies don't see a human or a person, somebody in front of them. It's on paper.
That's
it's
right.
all this, right? It's really easy for them to say, well, it's really not that serious. We're just going to give him 3 days in detox.
Yeah,
right.
We're going to approve 3 days. And medical detox, especially MAT services, they are expensive. The medications are really costly versus alcohol, where there's detox medications, but they're not nearly the cost of MAT, So it's definitely expensive to offer MAT services.
Do you think at some point, though, the MAT services and drugs will come down in price?
I hope so.
Yeah.
I would think
Well, I know like a Vivitrol injection is $1,500. So that's $1,500 a month.
Is that with insurance, you mean?
No, that's
without.
without insurance. That's what the shot is. I
Yeah.
don't know what they charge insurance, but I was paying Jeremy's Cobra insurance. That was $850 a month. So I could do it, but how many people couldn't do it?
Yeah,
And even
absolutely.
then I had to think, shoot, is it better? Whatever. I had to weigh my options, and ultimately I thought, just pay his insurance. Just, because he aged out of the system.
Absolutely.
People over 26 are often uninsured.
Yeah.
So,
The first 3 treatment centers I went to for my own drinking, drug Medi-Cal wasn't even a thing yet, and so they didn't cover any of that. And trying to come up with the $500 in cash just to get into detox, and then they kind of do this thing with once you're in detox, a case manager comes in to pull you aside and, hey, you like being sober right now? Well, if you want to continue being sober, I mean, and not exactly like in so many words, but it feels like that.
Yeah, definitely.
Definitely. And so what's happening is, we had a teen that came in. Parents were growing marijuana. They were cool with him kind of, at 14, dabbling in it a little bit. But when he started to get some buddies and they'd come over and all of his friends were getting into it, then that was a problem.
Right.
So mom and dad are like, you're going to rehab because you guys aren't all getting into my stuff. And it takes him into rehab literally with like the pull-up, drop-off, call us when he's ready kind of thing. And the kid was doing so unbelievably well in there, and mom came for the visit, and it was literally 16 days after we put them on kind of a lockdown a little bit where they don't get phones, get to talk or anything. And the mom comes, and it was just crazy to watch this kid just chest out feeling great, and mom starts walking up to him, and as they're just about to reach, he goes to like almost put his arms out to hug her, and she pulls back. And so then he pulls back. And all of us were just like, she had no idea what she had done in that moment, just with her body language of like, here this kid is like.
I know.
I know.
I know.
And I have to it's very, very hard. And that's why I think with this too, it is working in conjunction with the families. Addiction is a family disease. There's just no doubt about it.
Yes.
And that was something that was decided in the 50s, we can't just treat the alcoholic or the addict, the whole family. Actually, the family's really sicker than the alcoholic. Yeah, everybody needs to be a part of that,
Absolutely. Yeah. And kind of goes with the whole, they already feel bad about themselves or ashamed, so you don't want to do it more. So if this guy was actually feeling really good, I can't imagine how, like you said, just body language would kind of shift that.
Well, I think there's a lot of enabling that goes on in the family too, and I'll raise my hand to that. You do everything you can, whether it's right, and who's to say what's right or wrong?
Right.
Okay, because we don't have a cure for addiction.
Right.
So the only thing is that's what works for that addict.
And not
What
stopping
works
until
for
you
that
find
addict.
what does work, right?
That's right.
Yeah.
Yeah. But there are things, I would never, ever give Jeremy cash at a certain point. There's certain things we do as mothers or as siblings, with pressure. Oh, give me $20, give me this, give me that.
Like when I
so I think that family counseling should almost be required.
Yeah, absolutely. Well, that's
Anytime
the big
there's
that's
intervention.
one of the other barriers too, is that part of MAT is the conjunction, right? So the medication along with the therapy, because giving up the drug, it takes a lot more than that. You can't just be abstinent and think that everything is going to be okay. There's a reason why there's this dysfunctional thinking and these behavior patterns and stuff. And one of the problems is not having access to that biopsychosocial assessments, getting these clients access to mental health and getting them into therapy. And that's a whole nother thing that really boils my blood, actually. And one of the things that kept me up last night too was all of this funding for mental health and addiction, and yet there's more people on the street, and we get kicked back all the time when I refer someone that DCFS is asking that they undergo a mental health evaluation, and I have so many places I can refer to that are accept Medi-Cal, and I will send the client there, and the client comes right back and says they won't see me. They told me, and I'm like, what? So then I get on the phone and I'm calling these people, and it's crazy because it's almost like we have to dig our way through all of these little policies and stupid laws, and the poor kid that only got approved for 3 days in detox. That treatment center, what we ended up doing was, and this can get a little hairy right here, but we had to put it in as something else to get the insurance company to pay it so this kid could get the days that he needs, which is hairy, really. It really is, because on an ethical standpoint, which is something that I take really, really seriously, it's like, this kid needs help. I have him right here. He wants it. He's willing. He's all of this, and the insurance company's going to be the holdup. So I always look at it like when we're trying to fudge things a little bit through paperwork and through private insurance companies, my number one priority is what's the best interest of the client, period.
Right.
When it comes to private insurance and all of that, I hate to say it, but
no, absolutely.
Yeah.
You want to put that person's life first.
Right.
And like you said, it's kind of like they don't know the person, they don't see them. So really for them, it's just their job.
Right.
You know what I mean?
Right.
The paperwork and all this. So all those obstacles that you guys have to go through, it's like, to me, it's like so silly. Why are you making it so difficult to help save someone's life?
Right.
Is how I, from the ethical standpoint, is like looking at it that way. But
I got pulled aside by my clinical supervisor, who was literally like, Julie, I love that you care about all these people, not to throw him under the bus right now, but this is a business, right? And I do need, and that's really hard for me with all of this.
Yes.
It's really hard for me. To the point where my dreams of opening my own nonprofit and even Freehab and all these things that I want to do, I am completely gun shy because of that. The idea that there's being money exchanged for somebody's sobriety just really, and it's funny because my colleagues will all say, you went to school, you have a degree, this is what you paid money to do this, and that's true. I guess it's just people helping people, and it doesn't cost any money, or it doesn't cost anything to sit with someone and just listen to them and find out what they want, not what the family and everybody else wants, you know, which is always far different.
Definitely, yeah.
So,
well, and I feel that too. It's something that's very near and dear to your heart. You know what I mean? Because not only because of Jeremy, you know, but because you had the alcoholism. But it's just like, what was it? It was the day after Jeremy passed, or the day that he passed. You got that your first job, or what was it?
I was on my way to my interview when Patrick called me. Yeah, it was shocking, to say the least. It was about 9 o'clock in the morning when Pat called me, and you guys know him. He's definitely not a super emotional, dramatic kind of guy.
Yeah.
And it was really kind of ironic, and I know we've talked about this before, but I really feel like Jeremy's in a lot of what I do, and a lot in my work, and it is. Yeah, I got hired the day that Jeremy
passed away. Yeah. Which is
wow.
It's very strange, but also I think that there is some connection there too. Also, because I know how much Jeremy loved you and thought you were like the coolest cousin, and just thought you were so chill and easy and laid back. You know,
I have so much guilt for not actually speaking with him. It doesn't take much to just reach out to someone, and I'm gun shy a little bit, only because I don't want to make them feel a certain way, or feel like I wait for them to kind of come to me and then open that conversation. But listen, addiction is a very shameful thing for a lot of people to talk about, especially pregnant women, moms, all of that, you know. Very, very shaming. But I really wish that I would have had the opportunity to talk with him. Not that anything, I mean, God knows you did much more than I could have done for him, but just to get some support and know that he wasn't alone, and just to, you know, I really wish that would have happened, but it didn't.
Yeah.
Well, you can't dwell. You can't
You
dwell
can't
on
have
that.
regrets, because chances are he may have never opened up to you.
Yeah.
I mean,
Maybe.
you can't,
Yeah.
you know, all the
very
what
true,
ifs,
very true.
You know, you
Very
you
true.
just
The what ifs kill me, but
the what ifs
kind of.
You know, I have
because it didn't happen.
Yeah.
I have
on,
a picture in my office. I have a ton of artwork. Since I got sober, I started doing art, like you guys know, and I do puzzles and paint. So my whole intake room is just all of these paintings that were literally selected for them to look at while they're in there. Like, you know, the universe isn't trying to kill you, it's trying to wake you up.
Yes.
You know?
Right.
All these little things. And one of them that I made that I love is, if it, what did it say? If it shoulda, it woulda.
Yes.
You know,
Yes.
all of us that spend all that time going back to, well, if I would have done this and I would have done that, you know, kind of having that, you are just where you're supposed to be.
Exactly.
It
Just
takes
being in the
that
moment.
moment,
And
It takes a long time getting there,
Yeah.
but you know, in the end, that's what it's about.
Yeah.
You know,
And
now
I
what are
wish-
you going to do about it going forward?
Right.
Yes.
And I
You
wish the
know?
clients that come in that could see it that way. See, again, it really is that perspective thing. It's like everything horrible that happens that's devastating. And even with you, Rose, look at everything that's come out of Jeremy. And I know that what I said to you in that letter is the best way to honor him is to do good in his name and to do all of this. And I look around it. I mean, look at your Rebecca and what's happening for her and what it's doing. I mean, it's just amazing the lives that he's touching without even knowing it. You know, it really is.
Absolutely.
It's just absolutely awesome.
Yeah, thanks.
Yeah.
Well, it's almost like that, you know, that was his destiny.
Yeah.
You know, and I guess this is mine.
It's
I would have
about-
rather had something easier.
right.
President of like the Orchid Club or something, but you know what?
One of the things that helped me feel better about the whole situation, because sometimes it's still so hard for me. I'm like, why me? Why my family? Why? You know, like just, and then from like a medical standpoint, it's like there's so many other people out there that should be gone before Jeremy's life was taken, you know? So that's, I don't know, it's really hard, but I just feel like Jeremy was so well known in the community, and because we're, you know, very involved in our community and well known, I just feel like because it's our job to use that to make an impact. You know what I mean?
Maybe that's why we were picked.
Yes, as opposed to, you know, I mean, Jeremy, because he played club soccer, so he knew people from that. He played high school soccer. He went to the same high school, you know, and so we were all very involved. So that's the only thing I can think is like, you know, one life of his sacrificed to save all these other lives.
Yeah.
Maybe.
I know the most powerful thing we have as humans is the power of our story, which I think is universal across the globe with, you know, it's crazy. Every single mother across the world, whether Afghanistan, Pakistan, Syria, they all know the mother. Like, they all know what it's like. They all want the same things for their children. They all want, you know, it's a universal thing.
Which also, too, I think that's why you feel it so much, too, because you have a high school son.
Yes.
He's right, you know, very smart, very smart. I totally trust him, never think he would get into anything bad. But he, you know, it's like his age, that's who we're trying to educate because that's when that's where we see it starting.
And, you know, I'm scared to death. I'm not going to lie to you. Scared to death. And even with, I mean, since Jeremy, in our family, that's, you know, it really puts a spotlight. And just because I'm a counselor, you know, I'm also a cop's daughter, and you know what they say about them, right? So it's like, just because I'm a counselor doesn't mean that my kid is going to be the one that's not going to do that stuff. And as a matter of fact, if anything, it's the opposite,
Yes.
right?
He's more prone to do it.
Right. So I mean, honestly, if DCFS heard some of the conversations that I have with my son about some stuff, they would be, I look at it like, if I'm not willing to have these conversations with him, someone else is going to, and then I have no control over that, right?
Yes.
So it's all about me having the control and wanting to talk to him about this stuff. And, you know, I hope to God, when you look at Europe and why all of these interventions and their approach to opiates and opioid use, why it's worked so well, and I think a lot of that is exposure, you know, where here in America, there's a lot of sheltering with our kids. You know, we're doing their laundry. I mean, not even going to get into that and all of the millennial, Parents today are definitely too afraid to hurt their kids' feelings, right?
Definitely.
And they don't want their kid to be picked out or, well, I got him an iPhone. He was the only one who didn't have one. I don't want him to feel bad. You know, stuff like that.
Oh my gosh, totally.
Oh yeah.
Totally.
Oh yeah. And so it's important to be the parent that, you know, and your sister said it so well, Rose. Nadine, my mother-in-law, gave me the best advice. She said, Jewel, if you cut your heart off, you will always do what's in the best interest of your kid. It's all the feelings and the heart that get
The
in the way of
emotions,
that, right?
yeah.
Because it's hard. I mean, so many parents don't do what they need to do at the beginning with this, which is taking them into treatment, or wilderness camps, all these great programs, which is really, I really want to intern and go to Utah. There's a camp out there where you can go for 3 months and intern. And I think that would be so amazing, where they're hiking through the mountains and you're really doing like a wilderness, you know, discovery camp type of thing. It would just be awesome to experience that. Yeah.
That would be so cool.
Yeah.
Well, I've already had somewhat of a conversation with Sean, so.
Oh, good.
Yeah.
Good. I could use, hey, it takes a
Yeah.
village, right?
I
It takes
just
a
like
village.
stepped right in and said
Yes,
something
it does
to
take a
him.
village.
It
you
does.
know? You're
It
right.
takes a village.
But it's just, I mean, what I want to point out is both of you guys being moms, it's just funny because you are a counselor and you know so much about this, and yet you still have that fear in you, you know? You're like educated in every different way on all these topics, and you still have that fear, which, you know what I mean? It's like that's how precious your babies are to you.
Yeah.
And that's, you know, like you said, you'll fight to do whatever for them.
Yeah.
But you would think, you know what I mean? Because you're
Yeah.
a counselor and you're educated on the different ways to help and do this. You would think that maybe that would help a little bit, right? So that
Yeah.
it's very interesting.
You know, the second you think you got it, you don't have anything. And that's part of it too, always having that little bit of that healthy fear. And I know a lot of people in recovery that were 20-year alcoholics, got sober for 10 years, and can drink recreationally now. You know, everybody is really different with that. It's like, to each his own. If you have, recovery is just different for every single person. Everyone, you know, when I first went into treatment, like 9 months after I started drinking, I'll never forget my mom and dad really being like, Julie, I really don't think you have, I mean, you're not an alcoholic. Like, that was really hard for them to
Really?
accept, you know? And who knows? I could quite possibly be somebody who could drink normally one day. I'm just way too afraid to find out, and I'm not willing to take that step. And so I feel like everybody that is able to sustain long-term recovery always has that in the back of their head. Like we're one day away, we're 1 second away. And I tell that to my clients, there's really no difference between me and you at all. I might have a little bit more time, but I could easily go out tomorrow and you could have more. I mean, it really is one day at a time. Everything, it changes. You know, you have to, like you said, work for it. It has to be on the forefront. It needs to be the priority, because if you're not working it, it's working you.
Absolutely.
And that's just, you know, so I think even with parenting, your kids have to have a little bit of fear, right? I mean, if they don't have fear of you, they don't believe you, then you're not going to get anything accomplished. So I think having a little bit of healthy fear with that is kind of important. I mean, the parent that says, oh, no, not my kid. She would, you know, my mom, a parent would call up my mom and be like, look, I have $20 missing from my house. Your daughter was here. My mom's like, that was Julie. You know, she'd sell me right out. You know? You know, having that little bit, you always want to be a little bit nervous. Never let your guard down, because when you let your guard down, that's when stuff happens. And I've seen a lot of people that have blown good chunks of sobriety thinking that they could do that.
And the way, so the sober living house that we sponsor, one of the guys that runs it, Sima, and her husband Ross, he explained it to me, you know, that he has a lot of the younger kids in the house that are that'll ask him questions like, oh, how do you know, I can't imagine not drinking or using for the rest of my life. How do you do it? And he's like, I've been sober for 10 plus years. And he's like, I walked past a liquor store last night and struggled. Yeah. He's like, it is not something that just goes away. He's like, but in the back of my mind, I know that if I were to drink again, I would lose everything that I've gained. Yeah. And so it's the same thing that you said. He always has that little bit of fear in the back of his head. Yeah. And it's not easy. It's not a fix. It's not, oh, I'm sober for a year and this and that. Where he is and how he is, he's been sober for 10 years. He does not feel that he not only wants to start drinking, but it would be helpful in his new life, so he just stays away from it. But like you said, I know other people that have stopped drinking for a very long time, and then they'll go out and have a casual drink, and it's fine. It all depends on the lifestyle, but the main thing is that it's always going to be like a work in progress. It's always going to be something you have to be mindful of.
The brain is crazy, kind of like, you know, you break up with a boyfriend. Like right now, I can hear a song from like the 80s, back in Pinecrest days, and you hear a song and you instantly, or like you smell a cologne, like Obsession, reminded me of this old guy I dated, and you're instantly almost in that moment. Like the brain has an amazing ability.
It like takes you back.
Right, and so it's the same thing with that. You know, somebody who's not drank for 10 years and doesn't have a problem, and then one day there's just something that opens that up. And it's like, whoa, it's very, very powerful. If only people used or believed in the power on the other end of it, though,
right,
too.
on the other side.
Yeah, nothing's going to work if you don't believe it's going to work. You know, you have to believe in it, or else it's not going to happen.
Exactly, 100%.
Yeah. You know, we're lucky. We're in Southern California. We are a huge community. There's a marijuana shop, a Starbucks, a yoga, and you know, all that on every corner.
Yes,
but there are a lot of rural communities like Kentucky Ayahuasca in Campbellsville, where they have no access to doctors or any of that. So how do you bring that to those communities that are being hit hard by not even opiates, but methamphetamine and all this? And I think it's really cool. What they're doing is literally setting up like a kiosk type of thing with like a computer that it's anonymous and HIPAA, and they can access doctors and referrals.
Oh
and
my
it's just like
God.
so cool.
That's amazing.
Right? It's like so cool. Never would you have even thought.
Mind-blowing.
Yeah, that something like that would be happening right now. They are changing the way that Medicaid pays for treatment, because Medicaid was not paying for addiction rehabilitation because it was under the guise of mental, because it was under so many beds facility. It was a 16-bed facility, let's just say. Medicaid won't pay for that, so nobody's getting reimbursed for that. So now Trump is taking a look at opening all that. All 50 states now have to comply, and everybody has to have access to that, which I think is really, really cool.
Yeah.
There's a lot of great things that are happening
Definitely.
right now when it comes to policy. And the only disappointing thing, though, and the last thing that I guess we should bring up and maybe talk about is with all of these restrictions now on doctors being able to prescribe opiates. So now you're at a limit. My dad was, I think, almost had his foot amputated, and they gave him like 4 Norco, right? I'm like, wow. So for those that really need it, they're not getting access.
I know. It's
you
such
know?
a like double-ended sword in that way.
Yes. But what's happening is, because they're just one day done and stopped, it's throwing a lot of people that would normally be getting their prescriptions literally on the street to find this stuff, and throwing them into withdrawal. And then they don't have access to the treatment. So there's a lot. It's kind of actually what I was telling you I was up all night about was, it's this really weird double-edged sword, in that they want us to feel like they're doing something about this crisis. And you know, like seeing you talk even at city council is so cool. It's like the idea that everybody's coming together and we're going to work on this, but it almost feels like they just want us to feel that.
Right?
Yeah.
And they just, it's almost
it's
like they want
interesting.
us to feel it, put on a show, you know, and
Yeah, why
like we're
aren't
doing.
pharmaceutical companies paying for Vivitrol?
Yeah.
Why is that shot so expensive to a demographic of people that are on welfare that can't even afford it? Like, that just seems absolutely backwards to me.
Right.
You know?
Totally.
There are still so much more that needs to change, but the conversation has been started, and that's really a good start.
Yes,
You know?
it took a long time to get the conversation started, but it is. So
I don't think we have figured out the cure yet, and so
I don't think
I
there
know
is a
that I went in. I had a really bad cough. I couldn't sleep, so I went into my doctor. You know, the cure for me is codeine in cough syrup. She wouldn't even prescribe it. Oh no, we're not doing opiates anymore. My first thought was, you suck. I'm going to find another doctor. Like, really, cough syrup? I'm like 90 years old. I'm not going to become an addict. Okay?
Right.
And it kind of, it irritated the hell out of me, to tell you the truth.
Oh, yeah.
But, so, by doctors being, cut off from prescribing opiates, that's how we got into this situation in the first place.
Absolutely.
So, you know what? This will work. We'll hit it from a different angle.
Right.
We'll hit it from this angle. And, one day this epidemic will be over.
Yeah.
And that's what
yeah.
Dr. Torrington was saying, basically, is that he's not one of those doctors where, people can just come and get this. He has fewer clients because he spends so much time and he's so thorough with them, evaluating what they need. Is it, and you heard him, like he said, he's fine trying whatever, but it's like medicine isn't his first thing that he jumps to.
Right.
I was watching this show. I watch a ton of shows on like heroin and opioids, and I was watching this Family Talk, and basically this girl at a very young age got a back injury, was prescribed opioids for a certain amount of months, and then all of a sudden they're like, oh, no, you're done. And they cut her off.
Yep.
She said that she was going crazy and she was physically getting sick, and she said she went to someone and they said, go get heroin. It's going to do the same exact thing for you, and it's much cheaper. Wow. That's how she got addicted.
Ooh, so
same
many
guy,
get addicted.
same kid with his foot though. He got an injury and he was prescribed stuff, and then out of nowhere, they're just like, okay, you're done. You can't take it anymore. And for me, I would think you would maybe try and wean them off, right? Lessen the dosage, but they just cut these people off cold turkey.
Yeah.
And the brain, their body, everything was telling them, just fix this pain.
Right.
And that's why they go to the street drugs, and the ones that aren't actually the ones that are synthetic, right? And all the deadly drugs that are being made. So.
Right. Yeah, one of their big efforts right now is the reduction of opiates in people that are using it for chronic pain, which is a whole nother conversation.
I know,
right? I mean,
right?
you have 10 million people that are being prescribed that right now. They're scared, right? So they're going to their doctor to address this. How do I get off what's something else that I can do? The bottom line is nothing is going to touch it like an opiate. And, it's kind of like once you've seen something, you can't unsee it. It's really, really hard when something's worked when codeine's worked really well for you in the past, and now they're like, nope. It's like, well, wait a minute. That's,
You get a taste of that, and then everything else is like lesser.
And what they're finding is in these programs where they're really trying to reduce the opiate and introduce a non-opiate medication like the doctor was talking about, they're not willing to go through the extensive mat like we talked about. They want
taking the time, the research.
Right,
That's why I'm saying
right.
people like you and Dr.
Right.
Torrington we need more, and we value you guys so much.
Right. And I think that's the education of somebody coming in for chronic pain, not even starting them, or, it's kind of like, I never wanted Sean to have sugar because he won't miss what he doesn't know.
Right.
You don't even know. Honestly, I can't even take opiates really. I've taken once. I have an allergic reaction and my nose itches off. But I wouldn't have known that if I wouldn't have,
Exactly.
Yeah.
So again, the double-ended sword.
It's education. It really is. It's education, and getting these doctors that have these relationships with the pharmaceutical companies that are really just quite disgusting. Yeah, I mean, they're the ones that are prescribing and kicking this all down. So I worry about the people that are being reduced right now. And even though they are part of a study that they have to be part of this outpatient treatment to get all the research data, it'll be interesting. But so far, they have not been successful in cutting the amounts.
I was going to say,
Yeah.
I'd be curious to see if they were, but I don't think.
Well, I think it's well beyond pain. I think it's the, the brain, like Dr. Torrington said. You have trained your brain to need that,
Right,
whether or not
right,
you're in pain.
right,
Right.
right.
Often pain has nothing to do with it. Jeremy
Right.
had no injuries.
Right.
Right. It was those receptors, wanting to always be fired.
Yeah, it's like reprogramming almost
Yep.
in a way. And it's very much like that, the car wash that I call it, where they go through the car wash. All those receptors are wiped clean and they have no idea. They wake up like nothing ever happened. That's really the ultimate to never know.
Yeah.
Right?
I love all the analogies that our guests are using,
I
don't
know,
you?
they're
Because it just
smart.
makes me, it just dumbs it down and makes me be like, you're right. Yes.
I am the queen of
that-
analogies.
is that bad?
Actually, my clients say that to me all the time.
Yeah.
Where did that come from? I will always
No, because it's
throw out-
relatable.
Yeah.
Because
It's totally relatable.
I mean, there's so much stuff that you talk about that I have no idea. But when you put it you
Right.
put it into terms that I know,
Right. Absolutely.
Is that silly?
Absolutely. Yeah.
Whatever.
If only more of us could be more comfortable in our uncomfortableness, because that's
Right.
really where the change is and where the growth is. And like all of us that want that instant gratification, the second we're uncomfortable, we bounce. And I know for me, I have learned in the last 5 years that nothing changes in the comfort zone. You have to get out of that comfort in order to be evolving, right?
Right.
Now that I know that, I have sat through a lot of really painful moments that have made me want to just go, drink, or the thought of it, But I got to tell you, knowing now, when I'm uncomfortable, my stomach's turning and I'm sick or whatever, I'll look up and be like, I'm changing. And it's like that
Yeah.
idea that if we could just understand that with that uncomfortable feeling comes change.
Yep.
You just have to. It's like just pushing through it. You have to just stick with it and then get to the other side.
Dr. Laura said it beautifully one time. It was something about, walking through hell. You have to keep on walking. I'm in hell right now, keep walking. It's the people that stop and I don't want this and go back. Just keep on walking.
Keep
and that's
going.
really what it's all about. Yeah.
Absolutely.
I will never, ever, ever, ever turn someone away. So if this is out to the public, you can find me at 22110 Roscoe Boulevard, Suite 204, Canoga Park.
Holla.
Yes, I will never turn anyone away. You know what? I've been a Post-it on someone's desk before.
Yes.
I have waited to get into treatment for months on suicide watch, drinking myself to death with Paige in the bed with me. I mean, horrible stuff. And I'll never forget the day that treatment called. I had been up for 3 days with just anxiety and horrible. I had to drink every 2 hours. And it was 5 a.m. and I had the full-blown delirium tremens shakes and my stomach is turning. And I just wanted a shot of vodka, but it was 5 a.m. and I'm like, no one's, At 6 a.m, I waited and I drove down to the liquor store and I was barely could put. And I tell him what I want. He knows me. And I tell him what I want. And just as I'm about to pay for it, I just throw up all over this guy, all over the counter, everywhere.
Oh my gosh.
And this is so unlike me, because normally I am the people pleaser that wants to make everybody very happy. That would be like, let me get that for you. And I was like, bolt,
Sucks for you.
Gotta go. Sorry. But I grabbed that pint and I got in my truck, and it's 6:12 in the morning on my clock in the car, and I downed that whole pint of vodka, and it was warm. And I remember within 2 minutes, all of my symptoms immediately were alleviated. Wow. And then I just started crying because it was in that moment where I was like, look what this has come to right now.
Yes.
It's not even fun anymore, and that's what addiction is. It's not fun. You're just trying to get through the day. But the best part of all of that was bawling my eyes out, and the phone rings, and it was Tarzana and said, your bed's ready, check in tomorrow.
Oh my gosh.
And it's one of those great, like, we wait and we wait, being on the waiting list somewhere, and, you know, for families that don't have 40 grand, 30 grand to put out or mortgage their home or have a goat or a cow to bring to the table, what do? You know,
Exactly.
you're on a waiting list somewhere. So that is the biggest change right now that needs to happen. And if I can facilitate that, which is what I try to do, having these this relationships with other treatment centers, I'm like, hey, this is Julie. I got so-and-so here. Listen, you owe me. Remember that? You know, and I'm pushing them. I've even worked on scholarship beds with private, it wasn't Passages, but Cliffside, and getting them to offer a scholarship bed to somebody that really needed to get into treatment, and they did.
You're so awesome.
There are people that are willing to help. You know,
that's what we do.
Yeah,
that's what we're about.
Yeah.
You know.
100%.
Yeah, we'd like to get to the point where we have no limit on the number of people we help. I love that, and you know, you know.
Oh yeah.
You have to want to make a difference.
Yeah.
And anybody wanting to can always donate to our fund, and 100% goes to help addicts.
Yes.
You know, Rebecca works her little tushy off 24/7 and makes not one penny.
Right.
So
it's a labor of love for sure.
we do it. You know, our motivation. If we can save one person, I always say, save one mother from burying her child, then our efforts are worth it.
Yeah.
You know, we know that pain, and you know,
Absolutely.
You don't want anybody else to go through it. So, and you know, we have compassion for the addicts.
Yeah.
Absolutely.
You know,
It's a
we
100%
do. We see your suffering.
unconditional
We see it.
positive regard, and that's my thing. I will always treat you like a human with respect and positivity, despite what you may have done. I don't.
Right.
That's up to him up above or whoever else.
right.
That's not for me to decide. Coming at them with nothing but love, and what we know is everything grows in love. You know, if you can keep throwing love at them instead of judgment and shame and all that other stuff, they'll eventually rise.
Exactly. And so, Julie, before we wrap up, I just wanted, I know you said, what was that phone number? You said there's like a universal phone number that you can call. I think that would be really good to put out there.
LA County has a resource referral hotline for mental health and substance. If you, it's the old like 411. Remember the old?
Yes.
Okay, but it's pound 211.
Okay.
And what that is, it is through the substance abuse and mental health hotline. You can call up and tell them what city you're in. You're in looking for an assessment. I'm looking for a facility that accepts Medi-Cal or opiate treatment provider, anything, and they will be able to provide you with all the resources and give you all the phone numbers and get you moving.
That's amazing.
It is really amazing. With domestic violence, with DCFS, they actually cover a pretty broad area, you know, individual counseling and all that good stuff. But yeah, it's a great mental health hotline that we did not have available, God, even 2 years ago. So,
Absolutely.
Yeah.
That's wonderful.
Yeah.
And we encourage all people who are looking for help to reach out, dial that number, do it. You know,
Or call
there's-
Julie, go to our
there's-
website, whatever it is.
There's
There is-
compassionate people on the other end. We get it. You
There's
know,
a new and better way of life.
That's
I
right.
absolutely promise that. You do not have to sit and suffer anymore. It's not, you don't have to do that. There is a better life out there for sure.
You just heard the podcast $20, produced by Rose and Rebecca Castro and Bertie LeQuay, recorded at the New Media Agency Studios in Los Angeles.